Start rolling, and so you're with the CPRU?
CICU.
Oh, CICU. Okay, give me the right different questions first.
No, he comes and he tells me, and I'm thinking, oh yeah, sure. I'm like thinking of all these clapsy things, and I'm like, wait, did he say VAP?
Yeah, quality and rep.
Like, oh, did we think?
Yeah, no, you can talk about class too, honestly.
Yeah,
It's fine.
whatever we got. Well, the first question is about, what do you do on an everyday basis to keep patients safe from qualities and VAP?
So for Claudi's, we do daily Q12 Foley care. We make sure that the Foley is to the ground with no loops, so that there's no backflow. And as far as our VAPs, we do the inline suction. We do mouth care every 4 hours. Keep their head elevated 15 to 30 degrees. Try not to break the ventilator circuit.
So, on an individual basis, how are you involved in the process? How do you affect the process? And is there anything that you do personally to help kind of achieve this goal?
Personally, I think I am very protective of my patients, I guess. So anybody that comes in, I make sure that they do have good hand hygiene. Make sure that they're not, touching anything that's going to contaminate anything. So just kind of protecting my patient in that way.
Excellent. How has your unit pulled together around, preventing and reducing qualities in VAP? I mean, from a teamwork perspective, communication, things like that.
Yes, we all, I think, have gotten more comfortable in doing what we do to prevent these. We also, during rounds, will obviously talk about certain things to make sure, we want to take the Foley out as quick as we can, and just make sure that it's not staying in longer than it needs to be. So we have the physicians involved with that too. Every time that they round, they go over that. So
how's the relationship and communication with your providers?
Good. Yeah, everybody's on board.
Do you have any suggestions or best practices for communication with families or with providers?
No, I think just explaining to the families why we do these things and why it's important so that they understand why. I think when they understand the why and what it's preventing, they're more, willing to let us do what we need to do. Yeah, that was all. I guess that's all.
And any advice you would give to other units around this issue?
Yeah, don't be afraid to, even when a physician comes to your room and is not doing hand hygiene, or is trying to break the ventilator for whatever reason, not to be afraid to speak up and say, maybe there's another way we could do this that can prevent something.
Fantastic.
I think that's really great. Yeah. I think you hit on all the key points
I know, right?
around patient and family engagement, teamwork. If you had to speak about sort of the culture around keeping your patients safe from harm, from hospital-acquired harm in the CICU,
If
what would
any?
you say? Yeah, any.
I think consistency, maybe. Just being consistent with what you do with each of your patients, and making sure even newer nurses coming on are consistent with what our policy is, so that we can continue to prevent it.
Kind of like the cross-checking and coaching.
Mm-hmm. Yep.
All right, phenomenal.
Excellent. That was quick, short and sweet.
See?
You did a great job.
No. She runs out.